Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
The fear right now is that AI will replace healthcare jobs, especially pharmacists and health system teams. While AI will change how we work, it's not ready to replace clinical judgment or patient care. The tangible opportunity is using AI to take on non-value added tasks, improve efficiency, and free up clinicians to focus on higher level patient-centered work. Dr. Jason Chou, Vice President of the System Pharmacy Service Line at Ochsner Health, and Catherine Oliver, System AVP of Clinical Pharmacy Services at Ochsner Health, are here with us to explore where AI is delivering value today, where its limits still exist, and how health system leaders can move forward thoughtfully. I'm Kerry Schwarz, pharmacist with the Vizient Center for Pharmacy Practice Excellence, and your host. Jason, Catherine, welcome. So let's start with how there is a lot of fear around AI replacing healthcare jobs. How real is that concern in pharmacy and health systems today?
There is quite a bit of fear related to AI that stems from folks feeling they could be replaced by machines or technology. And quite honestly, is coming from a place of potential misinformation or maybe misunderstanding what the technology does. From what I have seen, we're hoping that AI will help supplement work pharmacists, pharmacy technicians, and other stakeholders on a daily basis, being more efficient in our work. I don't see AI coming in and starting to round on patients or having very robust patient interactions. What we've seen is being able to help facilitate non-clinical work.
There's definitely a lot of hype and optimism around AI and what it can do and how it does have the opportunity to revolutionize how we're delivering care. But I think we have to remember what humans are really good at that computers can't replace. That's the trust that we have from the public and from our patients that we take care of, and that human touch and that hands-on care. AI isn't positioned at this point in time to make that clinical judgment. There's nuance. There's an art to the practice of pharmacy and delivering care to patients that can't be replicated. You do have to take into account the patient's values and how sometimes they don't always line up with clinical guidelines. You can't distill that down to a clear algorithm.
Definitely real concerns. Instead of worrying about AI replacing jobs, we should be focusing on where AI can help us in our current position. If we focus on this and we identify the right use cases, what should AI be doing right now to support the healthcare team?
A really easy entry into this space is finding out more technical things that folks are doing that may not be the best use of their skill sets. There's a lot of busy work in what we do from a pharmacy perspective. There's a lot of things that we're doing that actually are dissatisfier to a lot of our team and employees, such as sitting on the phone waiting to talk to another individual or gathering information for a conversation for things like prior authorizations or insurance discussions. There's a great opportunity to be able to remove some of that from the team. I'm not sure that I know of any health system pharmacy that would say that they're so flush with resource that they couldn't be more efficient in some areas or would have the opportunity to do more value added for patient care. Being able to leverage the technology in that way is exciting, and it's something that we should be celebrating with our team members and helping them understand where there's some value.
The information that you're gathering and reviewing a patient to prepare for a patient conversation or an insurance conversation or make a clinical recommendation to your physician colleagues. And we found that sometimes you spend a lot of time preparing for that conversation and digging through the chart and reviewing labs and progress notes. And one thing that AI can do is efficiently and accurately summarize large amounts of information, even when it isn't discrete. Progress notes, free text types of things that can be surfaced and quickly organized for a pharmacist to review and make that a lot more efficient. We found a lot of value in that process.
Catherine and I finished residency around the same time. How much more efficient I could have been in rounding preparation. Going in early, sorting through a bunch of notes, labs. There's a lot of things that AI can do from a summary perspective that will make clinical pharmacists just that much more effective. So having more time to interact with the patients and providers. There's a lot of low risk application and supply chain. Our organizations are purchasing millions of units of drugs over the course of a year. There's a lot of complicated math that goes into that. There's a lot of complications with inventory management, multi-site management. We're being pressed to do more with less. The more efficient we can be in our ordering, in our inventory management, it frees up our team, but there's savings opportunities.
It sounds like you've got some really good use cases for people to get started with. Where should we draw the line?
It's the decision making. The summary can be generated and presented to the clinician who is reviewing, but the final decision really does go back to the clinician because you can't replace experience and some of that nuance. We can't remove the human. You can summarize literature and you can give talking points when you're providing medication education, but you also do have to take into account the patient preferences, how they don't fit along those clinical guidelines. You have to think about too the patient's attitude towards AI. There can be a lot of skepticism. You have to maintain that relationship and preserve that interaction with the patient. That final decision making shouldn't be left to the technology. You need that person who can look at the whole picture to make that decision.
There's all of these different components, factors that we're using to make really important decisions. The patient interaction piece is a growing amount of concern with in terms of how we leverage that technology in a more patient-facing way. Being able to acknowledge those limits is really, really important. It helps alleviate some of those fears about jobs going away and not being able to do certain activities based off of the technology taking over, making sure that we're honest and thoughtful with regards to just general patient care.
What do you all think is an appropriate level of interaction? What should be disclosed?
I'm more open with interaction with AI. I have some family members that I know for a fact would be very uncomfortable interacting with AI as part of their healthcare experience. We are looking at what are potential implications of patient level interaction is organizations disclose that they are utilizing AI. Patients do have a desire to understand when and how AI might be used in their care. There's also a lot of concern about the level of empathy that comes with providing patient care. We're very cautious in the way that we're looking to approach this.
One of the applications of AI in that direct patient care space is in ambient listening. So a lot of tools that offer that feature. Where that can really help is in a patient interaction in a patient room and you're visiting your provider, having a tool that's really listening. We're all familiar with some of those devices on our phones or other things within your home. It's important to introduce the patient to that feature and understand how that can potentially help. And the patient should have an opportunity to opt out where you can't adequately explain how you're using the technology and how that's aiding in your care. Patients also have a real concern around privacy. It does bring up those concerns and those questions that it gives the opportunity to provide, again, some education and some transparency as to how we're utilizing that technology.
What we can't have is situations where patients become frustrated with the technology. I had a recent experience, non-healthcare related, but had to deal with a customer service-based issue. It was clearly they were using some type of automation, and I found myself wanting to throw my phone down and yell because of the difficulty in trying to navigate. Those types of experiences are happening right now. It has a good opportunity to sour people on the use of AI, so we have to make sure that we are better than that. But there's also some really great information out there in terms of how AI is able to pick up on things with interacting with folks that we might not be able to, in terms of responding in certain ways, picking up on certain visual cues. The jury's still out, but certainly want to make sure that we're doing it in a thoughtful and responsible way and not eroding trust with patients, because that's paramount in the work that we're doing on a daily basis.
Ultimately, explaining AI as a tool and something that we use. Most of us can think back 5 years of some of the technology that we use every day. Google, for example, search engines. I can remember a time as a learner and in college where you had to go to the library to find resources, and it's here in the palm of your hand. When you think about it that way, it hasn't completely replaced libraries, but it's a tool that makes things a little bit easier and a little bit more efficient.
I remember when everybody was worried that spell check and grammar check was coming for our job. So I absolutely can relate to that. I'm really glad that you mentioned how AI can pick up on things we might not notice as we're focused on other things, and how ambient listening may be a big early win. So what are some other early successes that you all have seen with AI implementation?
One really great example is dealing with prior authorizations. Trying to explain how that process works, it can be very frustrating. There's a lot of digging through charts for, in some cases, very manual components for data. You're trying to piece that together in a way that tells a story that will make an insurer comfortable with using a certain therapy. If you talk to a lot of pharmacists or technicians who do that on a daily basis, it can be tough. certainly not efficient. And the way that some of our EHRs are set up, not necessarily in a way to make that super straightforward. We have seen technology used in that way to help efficiency, being able to speed it up, get patient therapies a lot sooner rather than later. The huge satisfier on the employee side because they're not having to spend as much time hunting for information and they're able to use their skill sets to get patients meds sooner rather than later, which is very fulfilling.
One of the applications that we've made on the inpatient space is making the clinical pharmacist day-to-day work a lot more efficient. In previous iterations of our services, we did make use of multiple reports to identify patients who needed a pharmacist review, patients that are on particular high-risk medications, for example, that may need to be adjusted based on their changing renal function. And that list would generate every day or every shift, and then the pharmacist would review that patient's chart only to determine they were on the appropriate dose of that particular medication. And what we've done now is deploy a much more robust set of rules that's able to evaluate large amounts of data within the chart to identify more specifically those patients who may need review. And we've been able to cut our time spent in chart review without ultimately leading to a therapeutic adjustment by 50%, which has been huge. So it frees up a lot of our pharmacists' time to do other more direct patient care things like medication reconciliation services and patient counseling that are value added that they previously didn't have enough time to do thoroughly.
From an employee engagement perspective, it's been a big winner for our staff who are able to use this technology and see it's not taking away jobs and it's not putting me in a situation where I'm concerned about the technology taking over, but they're able to do a lot more value-added things. And that's the feedback we've consistently received for anybody using these technologies in several of the use cases we've deployed throughout the organization.
Yeah, with so many great use cases and so much potential for application of AI in healthcare, we're seeing constantly new vendors and new technology pop up. And this is also a new experience for healthcare organizations to successfully vet and implement and operationalize AI technology from vendors. How can organizations navigate this new landscape?
There has to be a broad organizational stance on how they're going to leverage AI and vet AI companies. I don't remember any type of technology in all the years I've been a pharmacy leader that has created such a high number of products to meet very niche problems. It's exciting that a lot of solutions are coming around very quickly, but it's also frightening because there's a lot of vetting that has to go into these types of companies, given the sensitivity of information with patient information, the potential for patient interactions. Organizations have to have a global approach in terms of vetting what their minimum standards are going to be for the level of security that these companies are bringing forth, making sure that you're not reinventing the wheel. You don't want to have a health system bringing in 10 vendors that do ambient listening.
The sophistication of our electronic health records, to have something external to that, it has to flow well within your workflow. A siloed solution where I have to leave the medical record and go into, say, a web-based portal is not going to be fun to deal with. And the level of integration necessary for AI applications, it has to be able to integrate seamlessly into your health record, but also your inventory system and your purchasing system and your quality system to tie all that together. The amount of work it takes to achieve that level of integration, you want that vendor to provide a lot of different solutions for you. It's really important you understand all of what their capabilities are and also deeply understand the problem you're trying to solve. It can be very tempting to see a vendor come with a shiny new object that seems really novel, but when you dig down into how does it incorporate in your workflow and is it attempting to solve a problem that you don't have at your organization, that can lead to a lot of wasted resource, wasted time. Understand what your EHR has coming down the pipeline related to AI and how those might be part of your greater strategy rather than going to 10 different vendors for one or two different solutions.
A lot of what we do is so nuanced. You can have all of this technical expertise in building AI, but you also have to understand the downstream processes like clinical pharmacy care and inventory management and how drugs are purchased. the level of expertise or lack thereof. It's part of the vetting process in getting comfortable with certain vendors. You could be getting a fully baked product that has gone through a number of different settings and proved to be successful. You could also get a vendor who's looking to build something, who's looking for a lot of insight that is going to tend to be a lot more work and, quite honestly, a lot more risk as well.
We've covered a lot today, from vendors to patients to clinical to operational to things we can get started with right away and things that AI may not be ready for. What's some practical advice that you would give healthcare leaders at this time about AI adoption?
Making sure that we're not reinventing the wheel in terms of solutions, working with other service lines. A lot of the departments in the health system have very similar needs. The application might look a little bit different, but being able to comb through notes and pull out certain elements isn't unique to just pharmacy. Making sure you're partnering with others to be able to evaluate some of this technology. And then certainly making sure that you're incorporating all of the groups that are important in looking at this, like ITIS, legal, ethics, because of the nature of the work that's being done and the potential impact on patient care.
Not being afraid to dig in and learn. It isn't something we learned about in pharmacy school. I certainly didn't anyway. Being okay with saying, I'm really not sure, and asking a lot of questions and learning from others who've done it before, and approach it with a healthy dose of skepticism, but also be open to how this might improve our day-to-day work, our own team's engagement, as well as overall experience and outcomes for the patient. We might not know what that is yet, but we want to have our finger on the pulse of that as we bring new technologies into the patient care realm.
One thing that Catherine just mentioned, it was something I didn't fully appreciate when you're creating these partnerships, is how quickly some of these companies can move, making sure that you're prepared from an infrastructure standpoint to be able to move quickly with them. You don't want to be waiting on a vendor to come up with the newest, latest, greatest, or make modifications to a system to make improvements. Conversely, you also don't want to have your vendor waiting on you to advance some of those improvements.
Jason, Catherine, this has been fantastic. Thank you so much for joining us today.
Thanks, Kerry.
Thank you.
Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified Rx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.